So clear aligners are not something new. They've been around for around 25 years and they were first invented by a brand called Invisalign. And Invisalign is probably the most well-known clear aligner system, but you might have noticed when you see your dentist or orthodontist that there are other brands around that clinicians might be using. Essentially, all clear aligner systems are designed and work around the same sort of principle. It involves developing a series of clear plastic removable mouthguards, a bit like the one in the image above. And that mouthguard develops slight pushing pressures on the teeth to gradually guide the teeth into position. Now, the plastic, we know, can only push and control movements in a specific way. So you'll often find that your orthodontist or dentist needs to fit little attachments like this onto your teeth to help the plastic to push and control the delivery of forces to achieve a well-balanced, controlled outcome for their patients. So in order to get accurate treatment, what we tend to have to do is combine these clear attachments in conjunction with the actual plastic aligners. So does it matter what type of aligner brand you use? Because they are all effectively clear plastic removable mouthguards. However, there are little nuances between the material technology of the various companies, and that can affect the degree of flexibility that the aligner might have, or the degree of stiffness that could be delivered with the aligner. But equally, it might affect some of the clarity of that aligner in terms of how clear it might look. So there are little nuances between the different brands. All of them are designed using some kind of design software that the clinician will likely be using in your preparation of treatment. Now, the design software is a really important part of the clinical control for your treatment, because that's where the clinician can really plan how to make certain types of movement, how much space might be needed, and all of those technical things. And some of the softwares offer more control to the clinician than others, and that has a big bearing on the sort of design of your treatment. There are other nuances, like the type of attachments are pretty similar between the different brands, but some of the companies give you other auxiliaries like these little buttons here or these little bite ramps, and indeed some of them are now developing special expansion devices for younger kids when you need to create more space. So those little nuances might have a bearing on your treatment depending on the kind of treatment you might need. Clinician variables can also have an effect, because the expertise of your clinician will have a big bearing on the quality of your result. Because not all orthodontists do a lot of aligner work. Indeed, orthodontists are typically trained in fixed conventional braces when they're at orthodontic school, and dentists are only taught a very small amount of orthodontic understanding when they're in dental school. So you really need to maybe ask your clinician how much experience do they have, how many courses have they been on, how many cases have they done, to try to understand what level of expertise your clinician might have. Two key factors that your clinician needs to consider. Firstly, biomechanics. Now, biomechanics is the combination of biology and physics which need to be considered together when we're designing orthodontic treatment. And your clinician needs to have a good understanding of that, because it's really important that you set or establish realistic treatment goals when we're designing orthodontic treatment. Second factor is staging, and that's really about what tooth movements occur and when they occur within that aligner design. Because if things are staged in the correct order, you're more likely to have predictable and effective movements. Finally, a really important part of your treatment is how well it's monitored. And it's really important that you check in with your orthodontist or dentist regularly. Now, that can be done with in-person visits, but in this day and age, many of us are using technology like dental monitoring, which allows us to do both in-person and remote monitoring to really ensure we're carefully looking at every step of the way. So I hope you found this video useful, and good luck with your aligner treatment. If there's any questions or comments, please leave them down below. And if you know anyone that might benefit from this video, please do share.